The reference for this video is from the author, Zenaida Famerksa, MPH, RN. Mary Neese and Melanie McEwen, Nursing Care of the Community, is a comprehensive text on community and public health nursing in the Philippines. Nursing Care of the Community, Chapter 6, Family Health Nursing.
Family Health Assessment. This are interviews with one or more family members individually, interviews of subsystems within the family, example dyads of mother-child, parent-parent. Group interviews with more than 2 members of the family. Observation. Individual family members, dyads, and the entire family. Observation of the environment in which the family lives, including housing, the neighborhood, and the larger community. And physical examination and other health assessment techniques, such as anthropometry, measurement of weight and height, for example, may be used. Secondary data are the review of records like charts, health center records, and/or other agency records. Communication with other health workers or agencies who have worked with the family. The family data or genogram is a tool that helps the nurse outline the family's structure. 3 generations of family members are included in a family tree, with symbols denoting genealogy. Children are pictured from left to right, beginning with the oldest child. In cases where the spouse had a previous marriage or marriages, he or she must be positioned closer to his/her first partner, then the second partner, if any, and so on. Family Health Tree. Based on the genogram, the Family Health Tree provides a mechanism for recording the family's medical and health histories. Causes of death of deceased family members. Genetically linked diseases. Environmental and occupational diseases. Psychosocial problem. Infectious diseases. Familial risk factors from health problems. Risk factors associated with the family's methods of illness prevention, e.g., pap smears and immunizations. Lifestyle-related risk factors. EcoMap, tool that is used to depict a family's linkages to other systems. The important nurturant or conflict-laden connections between the family and the world. The flow of resources, or the lacks and deprivations. The nature of the interfaces and points to conflicts to be mediated, bridges to be built, and resources to be sought and mobilized. Organizing family data, family structure and characteristics. Are reflected in data on household membership and demographic characteristics, family members living outside the household, family mobility and family dynamics. Socio-economic characteristics includes data on social integration, educational experiences and literacy, work history, financial resources, leisure time interests and cultural influences, including spirituality or religious affiliation. Family environment refers to the physical environment inside the family's home or residence and its neighborhood. Family health and health behavior take into account the family's activities of daily living, self-care, risk behaviors, health history, current health status and healthcare resources. Family nursing diagnosis. Specific diagnoses as proposed by NANDA International, NANDI, serve as a common framework of expressing human responses to actual and potential health problems. An alternative tool is the Family Coping Index. This tool is based on the premise that nursing action may help a family in providing for a health need or resolving a health problem by promoting the family's coping capacity. 9 areas of assessment of the Family Coping Index. Physical independence refers to the family member's mobility and ability to perform activities of daily living, such as feeding themselves and performing activities necessary for personal hygiene. Therapeutic competence is the family's ability to comply with prescribed or recommended procedures and treatments to be done at home, which include medications, dietary recommendations, exercises, application of wound dressings, and use of prosthetics devices and other adaptive appliances such as wheelchairs and walkers. Knowledge of health condition means understanding of the health condition or essentials of care according to the developmental stages of family members. Application of principles of personal and general hygiene includes practice and general health promotion and recommended preventive measures. Healthcare attitudes refer to the family's perception of healthcare in general. This is observed in the family's degree of responsiveness to promotive, preventive, and curative efforts of health workers. Emotional competence is concerned with the degree of emotional maturity of family members according to their developmental stage. Family living patterns refers to interpersonal relationships among family members, management of family finances and the TO of discipline in the home. Physical environment includes home, school, work, and community environment that may influence the health of family members. Use of community facilities is the ability of the family to seek and utilize as needed, both government-run and private health, education, and other community services. Priority setting is determining the sequence in dealing with identified family needs and problems. Family safety. Life-threatening situations first. Family perception. Practicality. Projected effects. Determining appropriate interventions, supplemental actions which the nurse performs in behalf of the family when it is unable to do things for itself. Facilitative actions that remove barriers to appropriate health action. Developmental actions that improve the capacity of the family to provide for their own health needs. This type of intervention is directed towards family empowerment. Implementing plan of care. Implementation is the step when the family and/or the nurse execute the plan of action. The nurse should be conscious of possible barriers to implementing planned strategies, which may be family-related, nurse-related. Evaluation, determining the value of nursing care that has been given to a family. Well-formulated goals and objectives in the nursing care plan serve as the framework for evaluation. Types of evaluation. Formative evaluation is judgment made about effectiveness of nursing interventions as they are implemented. Summative evaluation is determining the end results of family nursing care and usually involves measuring outcomes or the degree to which goals have been achieved. The family-nurse relationship is developed through family-nurse contacts, which may take the form of a clinic visit, group conference, telephone contact, written communication, or home visit. Clinic visit is a professional, purposeful interaction that takes place in the family's residence aimed at promoting, maintaining, or restoring the health of the family or its members. Group conference, such as a conference of mothers in the neighborhood, provides an opportunity for initial contact between the nurse and target families of the community. Telephone provides easy access between the nurse and the family. The wide reach of mobile communication services in the country provides the nurse and the family with opportunities to contact each other through calls or short messaging services. Written communication is used to give specific information to families, such as instructions given to parents through school children. Home visit, a professional, purposeful interaction that takes place in the family's residence aimed at promoting, maintaining, or restoring the health of the family or its members. The nurse makes a home visit upon the family's request, as a result of case finding, in response to a referral, or to follow up clients who have utilized services of a health facility such as a health center, lying-in clinic, or hospital. Phases of a home visit. Pre-visit phase. Determine the family's willingness. Set an appointment with them. Formulate plan for the home visit. In-home phase. Initiation. Implementation. Termination. Post-visit phase. Documentation. The nursing bag. The nursing bag usually has the following: articles for infection control, articles for assessment of family members, articles for nursing care, sterile items, clean articles, pieces of paper, for lining and waste receptacle. Principles of the bag technique. Bag technique should help the nurse in infection control. Bag technique allows the nurse to give care efficiently. Bag technique should not take away the nurse's focus on the patient and the family. Bag technique may be performed in different ways.